Give me the news. I've got a bad case of loving you. No pill's gonna cure my head. I've got a bad case of loving you.
Good morning. It is Coronavirus Video Journal Day 71. It is the morning of August 21st, 2020, and I have nothing to report. No coronavirus cases overnight. Actually, I take that back. I had a single coronavirus patient, but that patient was already known to have COVID-19, and so therefore I don't really count it as anything new. Excuse me. Otherwise, that's pretty much it. Los Angeles County is plateaued. My hospital only has about 24 coronavirus patients, and over our Southern California system of hospitals, we have under 300. I think actually about 250. So our numbers have improved dramatically within our system. So good news, but otherwise nothing else really to report, nothing exciting. So we'll leave it at that. Light night, but stay safe, wear your masks, social distance, keep away from other people if you can help it. Stop eating at restaurants because it's dangerous even if it's outdoors. But that's it for me. We'll talk again tomorrow. Today is Coronavirus Video Journal Day 72. It is the morning of August 22nd, 2020, and I can say that for the first time in a while, I don't have a single coronavirus patient, and neither did my partner overnight, which is great. Our numbers are coming down significantly. The hospital only has 16 coronavirus patients in the hospital now. I thought I had a slam dunk coronavirus case tonight. And so did our radiology department. Patient's chest x-ray looked definitely like they had COVID. Their CAT scan looked like they had COVID. And then the test came back negative. So, and these are pretty accurate tests, so I don't know what to do. Don't know what to tell you. But that's pretty much it. Otherwise, everything looks to have plateaued in LA County in regards to COVID. And the rest is just me rambling on, so we'll stop it at that and talk again tomorrow, see if we get any new cases. As usual, stay safe, wear your masks, socially distance, socially isolate, and yeah, we'll talk tomorrow. Good morning. It is Coronavirus Video Journal Day 73. It is the morning of August 23rd, 2020, and overnight, I had a single coronavirus admission who happened to be a patient who already knew they had coronavirus. The patient has gotten significantly worse, and come to find out the reason for that worsening is simply that the patient now has pneumonia as well as an active coronavirus infection. But other than that, no more coronavirus cases for my group overnight. So pretty quick and easy. Won't waste your time. I got nothing of value to bring to this episode. So stay safe, wear your masks, and socially distance and socially isolate when possible. See you tomorrow. Good morning. It's Coronavirus Video Journal Day 74, right? It is the morning of August 24th, 2020. Happy to report, although somewhat disappointed, that myself and my partner neither had coronavirus patients overnight. Sorry, I'm really exhausted. We did have plenty of hospital patients to see, but none of them are infected. So it looks like we're downtrending and continuing to do so based on the last few nights, which is great for LA County. Otherwise, nothing really to report. In the news, we have gotten emergency authorization for the use of convalescent plasma, which is a use of plasma taken out of your body after you've been infected and recovered from COVID-19, and then that is taken and injected into people who are actively fighting the infection in the hopes that it helps them fight the infection better. We've been using it here in the hospital for a while now, and it has not helped. So I don't know what to tell you. It really hasn't shown any effect or improvement on our patients, but the research is still out. It hasn't been completed yet. Some research has come out saying it may improve your chance of living through this by 3%, but there's some issues with that study, and the major studies are still pending. So who knows? But other than that, the only advice I have to give you is do not eat white oleander plants. The president and the owner and CEO of MyPillow have been promoting the extract of this plant, which is crazy poisonous. And they claim that this is a miracle cure for COVID-19. No idea why they would say that, except for the MyPillow guy owns a huge part of the company that's making this drug. But the drug itself has never been tested for COVID-19, and the only known tests that have been performed using it are cancer research testing. So, yeah, it's an extremely toxic and poisonous plant, so don't eat it. It does not do anything for COVID-19. And yeah, that's it. Otherwise, wear your masks, socially distance, socially isolate, and stay safe, and we'll talk again tomorrow. Good morning. It is Coronavirus Video Journal Day 75. It is the morning of August 25th, 2020. And once again, no coronavirus patients overnight. Not even a suspected one that we're not sure of an answer yet. Some crazy interesting cases the past 2 nights, but no coronavirus patients. And since this is a coronavirus journal, those stories are for another day. So that's it. We'll keep this one short and sweet. No news yet about much. Apparently there's some whispers of AstraZeneca getting emergency approval for their vaccine candidate, and with the ability to skip stage 3 trials, although I really hope that's just a load of crap, because vaccines can prove to be extremely dangerous if not tested properly, and usual testing takes 7 to 10 years, and we're already trying to get through testing in less than 5 months. But other than that, no major news on the COVID front. So we'll keep it short and sweet today. That'll be it for me. Stay safe, wear your masks, socially isolate, and socially distance. And we will talk again tomorrow. Good morning. It's Coronavirus Video Journal Day 76. It is the morning of August 26, 2020. I finally got a coronavirus case. So one COVID positive patient who was actually transferred to us from another hospital without the knowledge that this patient had COVID. Patient was having breathing issues that were thought to be secondary to asthma that she's always had. So initially the patient was being treated for asthma, and for insurance purposes was sent to us. And when I got the patient, I started treating for asthma, but then tested for COVID-19 just in case, and the test came back positive. So luckily we take precautions like wearing our masks and things like that for any patients like this, just in case, till we can get test results back. And so therefore, luckily I was not exposed. So that's pretty much it for the night. We didn't have any other COVID cases overnight. So that's it. So fun and exciting that I got one again, but great that it's so few and far between. So, but that's pretty much it. Otherwise, it was an extremely busy night with lots of sick patients for all kinds of reasons, but only one COVID patient. So that's it for me. Wear your face masks, stay safe, wear your face masks, socially distance and socially isolate. We'll talk again tomorrow. Good morning. It is Coronavirus Video Journal Day 77, and it is the morning of August 27th, 2020. Overnight, we had 2 COVID patients that we have admitted. One of them was mine, and asymptomatic, so no symptoms. Patient was actually quite young and came in for chest pain, and we tested the patient for COVID because the patient may require some procedures today, and our hospital policy states that any procedure, like any patients that need procedures, have to be COVID tested even if they're asymptomatic. So we tested said patient. Said patient does not believe us because he has no symptoms, and is demanding that we waste precious tests retesting him to try to prove that this is a false positive. Despite me informing him that the type of tests we're using tend to be quite accurate when positive, because we're using antigen testing and not antibody testing, he doesn't believe us. He still just doesn't care. So he has been given the option to suck it up and be put on a COVID unit and let us take care of his heart issues, or he can get the hell out of my hospital, because I'm not putting him in a regular unit with other sick people who don't have COVID, because he's going to infect them all. So Dr. Froutan, don't play. Nonetheless, that's pretty much it for the day. As you can see, wearing yellow, so it is my last shift. I'll be back in about 9 days, and we'll continue on and see how the country is doing and how testing is doing, and how my hospital is doing. So until then, wear your masks, stay safe, social distance, socially isolate if you can, and we'll talk again soon.